Taiwan has relaxed its criteria for discharging COVID patients from hospital isolation, effective immediately. Previously, patients had to have no symptoms and they had to test negative for COVID twice in a row. Now they can also be released if they test positive, so long as their cycle threshold level is at least 34 twice in a row. This lower threshold only applies to patients who have had no symptoms for at least 3 days.
Since the outbreak of COVID, Taiwan has had more than 800 patients, hundreds of whom are still in hospital isolation. With long stays putting pressure on the medical system and a mental toll on the patients, the CECC has eased the criteria for discharge from hospital isolation.
Our local experience and foreign research both confirm that when the CT level is 34 or more, the patient is not contagious.
Meanwhile, from South Africa, a new variant of COVID is spreading fast. Researchers consider it to be even more transmissible than the UK strain. Not only that, its mutation has a greater effect on virus spike proteins, which could reduce antibody recognition and the protection provided by currently available vaccines. Besides South Africa, the US has also reported homegrown mutations in the state of Ohio. Officials say they're keeping a close watch on the issue of mutations.
So far, what we've detected is, since last October, we've been targeting cases with low CT values for COVID strain cultivation. We have already conducted genetic sequencing on 38 strains. 5 of them are British variants. 1 is the South African variant we announced yesterday. There is still very little information on the U.S. variants, but it seems to be the case that these variants do not reduce the effectiveness of vaccination. If they did reduce the effectiveness, there would be an immediate announcement.
So far, no evidence indicates that the variants cause more severe illness. But don't ditch the mask or hand washing just yet. Basic prevention can help avert a full-blown crisis.